Hi everyone, and welcome to my YouTube channel. Don't forget to hit that subscribe button and the like button for this video. In this training video, I'll be demonstrating the CNA testable skill, dress this client with affected right arm. So without further ado, let's go ahead and get started.
Come in.
Good morning, Miss Elizabeth. My name is Julie, and I'm your CNA, and I'm going to help you get dressed this morning, okay?
Yes.
First, I just want to do a quick safety check. I want to make sure that your bed is in a low safe position, bed wheels are locked. Here is your call light, okay, just in case you need me for anything. And I'm going to go ahead and provide you with some privacy, okay? I'm going to go wash my hands and gather my supplies, and I'll be right back. Now for this skill, all you'll need to collect are 2 button-down shirts, okay? And you need to do this in order for the resident to choose which shirt he or she would like to wear. All right, Miss Elizabeth, I have 2 beautiful shirts for you. I have a yellow Hawaiian shirt and a blue checkered shirt. Which one would you like to wear?
Let's go with the yellow.
The yellow? Good choice. Yellow's my favorite color.
We need a little sun.
Ah, yeah, I know. Okay, and to help you remember the critical element step, which is dressing the right arm first, go ahead and place the shirt on the person's right side. Okay, that's going to help you remember. In this skill, you have to take off strong and put on weak. Okay? So what I'm going to do right now, Miss Elizabeth, I'm just going to put your call light right here. You want to make sure, place your arms underneath, that you don't overexpose the resident. The sheet has to be covering from the chest down, okay? The first thing that you want to do is take off the person's gown and immediately place it in the soiled linen container. Miss Elizabeth, if you could raise up a little bit. And as you see how I have my hand across the client's chest, holding the gown in place. Okay, go ahead, place down. And I'm going to take out your left arm here. Okay, and I'm going to move the gown over to the right side so it'll be easy for me to pull out. Okay, now this is really important for you to do. Because the right arm is weak, that means that you're going to have to support that arm. And the easiest way to do that is to hold the person's arm in your hand like so. So I'm supporting the wrist joint and the elbow joint. Okay, Miss Elizabeth, I'm just removing the gown from your right arm. Make sure I don't overexpose you while I do so. And once you get the gown down far enough on the arm, you can go ahead and let her rest her arm on the bed. So now you're working with 2 hands. And you want to roll the gown away from you, making sure not to overexpose and making sure that the gown is not touching your clothing. Immediately dispose of it in the soiled linen container. All right, Miss Elizabeth, I'm back. I'm going to go ahead and get you dressed in this beautiful yellow Hawaiian shirt, okay? So again, you want to make sure you do not overexpose the person, and you want to make sure that you support that person's weak arm. The easiest way to do so when placing the shirt on the person is to place your arm inside the right sleeve. Then as you held it while you were taking the shirt off, that's the way you're going to hold and support. Again, I'm going to move the shirt. I'm supporting the wrist and the elbow joint, okay? I'm going to go ahead and slide the sleeve on. And then I'm going to gently place her arm down. Now, the first time while I was taking off the person's shirt, I actually had my arm laid across her chest to hold the sheet in place. But now her left arm is strong, so you can either do that, or you can have the person, ask the person to hold the sheet in place with their chin, or you can ask them to hold the sheet in place with their arm. Right now, because I'm getting ready to dress that left arm, I'm going to ask the client to hold the sheet in place with her chin. Miss Elizabeth, can you hold the sheet in place for me with your chin so
Yes.
I won't overexpose? And can you lean forward for me a little bit? There we go. And this way you can work with both hands. Okay, go ahead and lie back. There we go. And again, I really don't have to support this left arm because it's her strong arm. So I'm just going to direct her what to do. Miss Elizabeth, you can go ahead and put your left arm in the shirt. And there we go. Now that I have the shirt in place, I'm going to ease the sheets down, making sure not to overexpose. And voila. Okay. You do not have to button down the shirt. All that needs to be done is that the shirt is in place and the resident is not overexposed. So don't waste time buttoning the first 3 buttons because you no longer have to do that. All right, Miss Elizabeth, you look so beautiful in your yellow Hawaiian shirt. I'm going to give you your call light. Make sure you give the person's call light in their strong arm, which is their left arm. If you give it to them in their right arm or put it on the right side, you could get tagged for the indirect care skill of safety, okay? All right, so I'm gonna do my closing procedures. I'm gonna make sure that the bed is in a low safe position. Bed wheels are locked. Resident has their call light in their strong arm. Privacy is maintained. Washing my hands, skill complete.